Well, today's the 24th of October, and today seems to be the last day of me having these bandages on that Dr. Phillips put on for the treatment of my lymphedema. I received my compression hose today, and I'll be putting those on, which is the ultimate goal of this lymphedema treatment. So, without any further ado, I'm going to remove these bandages, and I will be putting the compression hose on. Now, when she took these off of me, when Dr. Phillips took these off of me yesterday on Monday, or excuse me, 2 days ago on Monday, there was quite a difference in the reduction of edema in my legs, ankles, and feet. Which means that these wrappings, these compression wrappings, have been helping a good bit. They were so good that in my feet I've noticed that I could see the veins in my feet and ankles, which I previously have not been able to see before. These are very similar to ACE bandages, but they have less compression than a regular ACE bandage. And as you see, Punky, my cat, wants to get into the picture here too. So, I'm hoping that there is less edema, so these socks will go right on. Can't seem to find the end of this one where the tape is. There it is. Then underneath all these compression bandages is something that's like styrofoam, but it stretches. And this is set aside. I use this over again. Wash the bandages and such, but definitely get rid of the overlay of cotton that's put on here to comfort, so the constriction of those bandages aren't massive. Then we have this stocking that's put over that helps protect the leg. And as you can see, my toes are wrapped. This wrapping of the toes also keeps the edema from swelling my feet. So as you can see, there's this leg here. You can see a pronounced veins in my legs, the bone here that's on my ankle. So, be back in just a minute. Forgot the lotion. Then before I put this overstocking on and the compression hose, apply some Eucerin. This is a Eucerin intensive repair. Because I've had these on and off for close to a month. I'd like to reiterate what I did in my Twitter account. This Dr. Kristin Phillips has done more for me in the treatment that I've received from her than the same treatment that I received while I was in Kentucky, because her technique is a little different than the technique that was used there. Perhaps that's because she's certified for that treatment and the Kentucky staff was not. So I put this on here because this has been covered up and it does get dry. And it feels good to get wrapped. But this leg is down considerably, but I believe it is the right leg that is down more in contrast to the left leg. So once again, I'll put this overstocking of this gauze stocking over. Bring it right to the tips of my toes and up to just under my knee. Then I'm going into the first pair of the compression nylons, compression hose, however you want to describe it as, and applying those. These I'll have to wear the rest of my life and are to take the place of these stockings. So now you can see the difference here, I'm sure, of what it looks like wrapped and what this looks like unwrapped and just with the compression hose on it. They feel quite comfortable. They're not too tight, and they was no difficulty in getting them on like the ones that I had from Kentucky. At present time, these feel very good and very comfortable. They do not come up higher than the other ones that I had in Kentucky, where I was getting a lot of discomfort under my knee, under here. So we'll see how that one goes there. Now we'll take the compression stockings off of the other leg. There we go. Now this leg here had more of a marked difference as far as the diameter in centimeters of the edema swelling. What Dr. Phillips did was she took readings from here to here and at different intervals, clear down. She took first readings before any wrappings were done at all for a baseline. Then she subsequently, every time I went, which I went on a Monday and I went on a Wednesday, and every time that I would go, when she took these off, just as like I'm doing now, she would take new measurements of the edema from those different points. And when I went there this last Monday, and since I wore them, these compression wrappings, for 5 days instead of the usual 48 hours, there was even more marked difference in it. Therefore, with the difference that there was, she thought it would be prudent at that time to order the compression hose. She went ahead and ordered those. I got a call from the company that supplies them on Tuesday that they would be here on Thursday. Once again, the overlying gauze stocking comes off and the wrappings over the toes. And I hope the camera can pick that up. You can see a very marked difference on here. Before this, you could not even define where this bone was here. There was no hollow point here. I don't know if you can see the veins in my instep here. Could not see those. And there's a very marked difference from what there was. And once again, just like we did to the other leg, I will put the Eucerin on here. Soften all that skin, make it a little softer than what it was. Now I have to wear these every day, the rest of my life, to keep this edema down and to keep the lymph pumping back through the action of wearing these support hose to where I'll not be plagued by this edema again. The only time I take them off is when I recline at night for the night, and that's I sleep in my own hospital bed in my own home here, and I recline with my feet just an inch above my heart level, so my feet are elevated at all times. That will prevent any filling of the edema and everything. Now this Eucerin feels very good on here. And like I said, there is a marked difference. It's been quite a while since I was able to see this vein here. Before, there was so much edema on here that my feet looked like large sausages with sticks in them. So once again, put the overstocking of gauze on here. This protects me from the chafing of the support hose. This was my suggestion. I asked if it was possible, as we'll see, because number one, it keeps the support hose cleaner from the sweat and such. And two, I've been chafed before and found that the support hose before that I wore were very uncomfortable on the bare skin. So that's one reason I'm trying out this method first. So we get these, and I believe the strength of these support hose is the 14-15. Now, as I'm putting this on, I'm feeling the effects of the one on my left leg, and I can tell you right now that it feels very good. So there you have it. There is the removal of the compression bandages and the application for the first time of the support hose, which at the present time feel wonderful. Dr. Phillips definitely knows what she's doing. Thank you, and you all have a pleasant day.